So I want to go into like a kind of related but a little bit of a touchy subject, which is the subject of vaccines. And it's one of those subjects that is so confusing to me as a doctor, as a scientist, because science is about asking questions.
They can't ask questions about
And
vaccines.
it's about having a hypothesis and proving it negative, right? That's kind of the basic scientific method. And if you question anything at all about any vaccine, you're immediately able to be an anti-vaxxer. And you can't say, well, is this vaccine safe? Is that vaccine safe? What are the risks and benefits of each one individually? What about them combined? And it's just the weirdest thing. It's like heresy. And I experienced this personally, like at Cleveland Clinic when I was there. Somehow, because people thought I was anti-vaxxer, the pediatric department got very upset.
You get that label, it's over.
And I literally had to write a letter like, no, I'm not. I've been vaccinated. My kids are vaccinated. But it's important to actually ask questions about this, because if there's signal somewhere that there's an issue, we should look at it. And you wrote a very courageous paper that was published that you co-authored it was published in Journal of Medical Ethics, and it was talking about whether or not we should be giving vaccine boosters to young adults going back to school. And you basically said that in a survey of all the data, and I'll let you unpack it, but the punchline was that the risk of getting it was worse than the risk of not getting it. And I wonder, one, can you tell us about that study? And two, what has been the reaction? And have you been now labeled an anti-vaxxer?
Yeah, sure. I've gotten that label a little bit for questioning the booster vaccine in young, healthy people, especially who have already had COVID. So the question is, with the vaccine booster in young, healthy people, is there a benefit? And there was so much controversy, and I saw how at the FDA it was pushed in with the political might of a top-down order, that it made me ask some questions. The two top vaccine experts at the FDA were directly fired by their superior for questioning the COVID vaccine approval for young, healthy people. That is the booster, not the original. So the CDC never released the data, and only the data we had was observational. The clinical trial data on the booster, it was basically just reamed through. They didn't go through the normal process. So then when you look at the risk of myocarditis, not to mention the other claims that are out there of people being messed up or injured or not the same after the vaccine, again, high-risk people, early in the pandemic, it was very clear the benefits outweigh the risks. But when you get down to a young, healthy 12-year-old girl, does she really need 6 COVID vaccine doses in 3 years?
Yes, because Moderna needs to make a profit.
Well, they weren't too happy with me. Moderna constantly has people at their company trying to reach out to me. Yeah. And what is the risk of myocarditis of the COVID vaccine in a of the COVID booster in a young, healthy person? I ask that every time I'm engaged on this topic with someone who's like, how dare you not support the vaccination with the COVID booster in young, healthy people? Well, what is that risk of myocarditis? It's 1 in 2,200 to 1 in 2,800. Heart injury from myocarditis. One person in a study of about 2,000 died in an ICU. Two others were admitted to an ICU in the New England Journal. This is the New England Journal. It's not like I'm making it. So on a societal level, is there a net benefit or a net harm to giving the COVID booster to a young, healthy population? It's a net harm. If we actually do the math, it's a net harm. Very small harm. But to mandate it, to force, you're going to create never-vaxxers by doing that. Right.
I mean, in your study, you basically looked at like over 40,000 people, young adults, and found to prevent one COVID hospitalization, you would have to trade that for 18.5 serious adverse events from the mRNA vaccines, including the myo and pericarditis.
And we don't even know if that hospitalization, that's based on data where we don't know if the hospitalization is for COVID or with an incidental COVID positive test.
Yeah. But you're talking about like you have to vaccinate, 40,000 people to prevent one hospitalization, but you get 18 serious adverse events.
You got to burn the village to save it.
That's a problem. And so what's been the reaction to this article that you published and to this view? Because it's like you can't have this conversation. It's like you're not allowed to have this conversation.